We recognize that the number of cases in Haiti has increased significantly, and not only that, that has spread to the Dominican Republic. There are cases in the Dominican Republic now as well. So we are definitely even more at risk in terms of persons bringing it into Turks and Caicos, and then it's spreading throughout the community here in Turks and Caicos.
Despite the knowledge that the chances are high that cholera will eventually make it to the Turks and Caicos, the medical ministry is keeping their promise and continue to monitor the situation here in the TCI, keeping a particular check on persons traveling to and from Haiti.
We continue our surveillance activities at the ports in terms of our public health staff going and meeting the various airlines and doing the various health checks, as well as education to the individuals coming off those flights to remind them of basic hygiene, sanitations, etc.
Monitoring the health status of TCI residents and creating awareness of the disease, according to Ewing, is a priority as well.
We continue our surveillance for diarrhea, in case of diarrhea. We are asking people to continue to come forward to the health centers, health facilities, and those that meets the case definition in terms of recent travel to Haiti, very loose watery stools, etc. Those individuals, those samples are taken and sent to for laboratory testing.
The department has tested over 80 diarrhea samples, and there have been no cases reported up to date. However, according to Ewing, this is nothing to be comfortable about.
We know it's just a matter of time, more than likely. So what we need to focus on is stepping up our surveillance, our education, our prevention activities to one, prevent it from coming. Well, I don't know if that's possible. And two, detect it early if it comes, to prevent dispersal within the communities, and then to set up the various response for treatment in the various treatment centers, etc.
The ministry does have support and backup, according to Ewing, if cholera enters the TCI.
We are working with the Pan American Health Organization in this regard, and we recently received support from DFID, the Department of International Development from the UK, and they'll support us heavily in terms of both financial and technical support, and we should probably be bringing in a team of individuals within the next week or so from PAHO and DFID on the ground here to ramp up to scale up the response in terms of surveillance, in terms of setting up, identifying and making sure that we're ready with treatment centers and materials and supplies and relevant manpower on the ground.
News 4 will keep the public updated on this matter.